Depression, also known as major depressive disorder, MDD, is a common yet serious medical condition that negatively impacts a person's mood, thoughts, behavior, and overall health. It causes persistent feelings of sadness, hopelessness, and a lack of interest or pleasure in activities that one normally enjoys. Depression can interfere with daily functioning and may lead to emotional and physical problems. Causes of depression. Depression is a complex condition with multiple causes. These can include 1. Biological factors, neurotransmitter imbalance. Neurotransmitters like serotonin, dopamine, and norepinephrine play a role in regulating mood. Imbalances in these chemicals can contribute to depression. Genetic predisposition, a family history of depression can increase the risk. Certain genes may make individuals more susceptible to developing depression. Hormonal changes, changes in hormones due to pregnancy, childbirth, menopause, or thyroid problems can trigger depression. 2. Psychological factors, stressful life events, traumatic events like the loss of a loved one, divorce, financial difficulties, or job stress can lead to depression. Cognitive distortions, pessimistic thought patterns or negative self-beliefs can increase the likelihood of depression. 3. Environmental and social factors, isolation, lack of social support and feelings of loneliness can be risk factors. Abuse or trauma, childhood abuse, sexual trauma, or any form of prolonged stress or abuse can increase the risk of depression later in life. 4. Medical conditions, chronic illnesses such as diabetes, heart disease, or chronic pain can contribute to depression. Certain medications, like steroids, sleep aids, or other prescriptions, may have depression as a side effect. Signs and symptoms. The signs and symptoms of depression can vary in severity and duration, but they typically include 1. Emotional symptoms, persistent sadness, emptiness, or hopelessness. Irritability or frustration over minor matters. Loss of interest in hobbies, work, or social activities. Feelings of worthlessness or excessive guilt. Thoughts of death or suicide. 2. Physical symptoms, changes in appetite or weight, either weight gain or loss. Sleep disturbances, insomnia or excessive sleeping. Fatigue or lack of energy, even after rest. Unexplained aches or pains. 3. Cognitive symptoms, difficulty concentrating, making decisions, or thinking clearly. Memory problems. Reduced ability to function or perform tasks at work or school. 4. Behavioral symptoms, withdrawal from social activities or family. Decreased performance in work or school settings. Increased use of substances, alcohol, drugs as a form of self-medication. Risk factors. While depression can affect anyone, certain factors can increase the likelihood of developing the disorder. 1. Genetics. A family history of depression increases the risk. 2. Gender. Women are more likely to experience depression, partly due to hormonal fluctuations and social factors. 3. Age. Depression can occur at any age, but younger individuals and older adults may be more vulnerable to certain types of depression. 4. Personal history. Those who have experienced depression in the past are more likely to have recurring episodes. 5. Stressful life events. Major life changes, such as the death of a loved one, divorce, or job loss, can trigger depression. 6. Chronic medical conditions. People with long-term physical health conditions, such as diabetes or heart disease, are at higher risk. 7. Substance use. Drug or alcohol use can contribute to the development of depression or worsen existing symptoms. Management of depression. Managing depression typically involves a combination of the following approaches. 1. Psychotherapy. Talk therapy, cognitive behavioral therapy, CBT, helps individuals identify and challenge negative thought patterns. Interpersonal therapy, IPT, focuses on improving communication skills and resolving relationship problems. Psychodynamic therapy explores past experiences and unconscious patterns of behavior. 2. Medications, antidepressants. These medications, such as SSRIs, selective serotonin reuptake inhibitors, SNRIs, serotonin norepinephrine reuptake inhibitors, and tricyclic antidepressants, work by adjusting the levels of neurotransmitters in the brain to alleviate symptoms. Anti-anxiety medications. In some cases, anxiety and depression coexist, so medications to treat anxiety may be prescribed. 3. Lifestyle changes. Exercise. Regular physical activity is shown to improve mood and overall mental health. Diet and nutrition. A balanced diet can improve mood and energy levels. Sleep hygiene. Establishing a consistent sleep routine can help manage symptoms. Mindfulness and meditation. Practices like mindfulness, yoga, and deep breathing exercises can reduce stress. 4. Support systems. Having a strong support network of friends, family, or support groups can be a valuable part of recovery. Peer support groups. Talking to others who have experienced similar feelings can provide comfort and understanding. 5. Hospitalization and electroconvulsive therapy, ECT. In severe cases where there's a risk of harm to oneself or others, hospitalization may be required. Electroconvulsive therapy, ECT, used when other treatments fail. ECT involves sending electrical impulses to the brain to treat severe depression. Prevention. While depression may not always be preventable, several strategies can reduce the risk. 1. Stress management. Learning healthy ways to cope with stress through relaxation techniques or mindfulness. 2. Building resilience. Developing emotional resilience through therapy, hobbies, and strong social connections. 3. Early intervention. Addressing signs and symptoms of depression early on can reduce its severity and help prevent future episodes. 4. Healthy lifestyle choices. Regular physical activity, a nutritious diet, and adequate sleep help maintain mental health. In summary, depression is a serious but treatable condition. With the right combination of therapy, medication, and lifestyle changes, most people can recover and lead fulfilling lives. If you are